Fox 24 and the American Red Cross are teaming up for another blood drive. Joining us with the details is our friend Ashley Henyon of the American Red Cross Palmetto SC region. It's good to see you again.
Thanks for having us.
Yeah, so how have things been going? The last time we spoke and the last time that we have done our interview with the American Red Cross and partnered with them for blood drive, it's just been a little bit tough considering COVID has just been putting a wrench in the works for everyone.
It's been tough, and right now we are looking at one of our toughest months yet since this global pandemic hit. So October 2020, we are really trying to urge anyone who's eligible to come out and give the gift of life. And of course, we have a blood drive that we're working on together right now.
Yes, and we're always happy to partner with you. Anything we can do to get the word out, because blood supplies are so crucial. And maybe you can give us a snapshot of what it is that you're missing, because in a good year, how would you compare that to 2020, if you could?
Well, the thing with the way the Red Cross works is that we rely on community partners, schools, churches, corporations, and a lot of those have been closed and are working remotely now. So that has really put a dent in our ability to collect life-saving blood. But here's the thing: is that the need for blood is constant. It is not going to go away. There are still cancer patients that need treatments. There are still mothers that might have complications during childbirth, and they might need a blood transfusion. There's people suffering from sickle cell disease who need regular blood transfusions. So we need to make sure that everybody eligible gets out and donates blood, not just once, but every 56 days when they're eligible to do so.
And that's the space of time that you have to wait before you can give blood again.
Absolutely. Yep. Every 56 days, eligible blood donors can come back and donate blood again.
Okay, that's good to hear. Now, what happens if someone tests positive for COVID? It's a real possibility.
So what we're doing at our blood drives is we're actually testing for antibodies. We're not testing to diagnose the disease itself, but we're testing to see if there's a presence of antibodies in the blood. And so what that's going to do is that's going to allow you to make a whole blood donation. And if you do test positive for the antibodies for COVID-19, your blood will be tested again. And then if it's still deemed eligible, we'll actually be able to pull a convalescent plasma therapy treatment right from your whole blood and potentially help a person who is hospitalized with COVID-19.
Okay, so October 13th, that's a date everybody should mark on their calendars. And where is this taking place? What time? And how do we make an appointment?
Yeah, it's at the NORTHWOODS Mall. 11 a.m. is the start, and it's going to run until 7 p.m. And the easiest way to make an appointment is to go to redcrossblood.org.
Okay, perfect. And you do encourage appointments. That's what one should do.
Oh, yeah, absolutely. The best thing to do is to make an appointment, especially right now since we're trying to space out our donors and practice that safe social distancing. But if you do want to walk up and walk in, if we can take you in, we will. And remember, there's some great incentives associated with the blood drive on the 13th of October. Free tickets to Magnolia Plantation. And we also have the ability to enter donors into a drawing for a $1,000 Amazon gift card.
Oh, very nice. So that's a really good incentive. I mean, if the incentive wasn't enough that you're out there helping somebody else, you get to go to the wonderful Magnolia Gardens. That's great. Again, October 13th, not a Friday, by the way, on a Tuesday. That's okay.
Right.
Nothing scary about this. And it's pretty
Not
painful.
at all.
You make it a very pleasant experience.
Quick and easy, and our staff is great. They'll take care of you every step of the way.
Yes, they do. I can vouch for that. Ashley, I want to thank you so much, and we're going to share that information. Best of luck. Got to raise that blood.
Thanks so much for your partnership.
We're back after this.